So we are now live. So good morning, everyone. It's really nice to have you all here, and good morning as well to our audience. So welcome everyone to Think Young's Resilience and Vaccination, Fostering Prevention to Build Back Better. It's a real pleasure to have all of you here, and like a big welcome to all of you. So the webinar wants to address a really important topic at the moment. In fact, the spread of COVID-19, as we all know, has put healthcare systems around the world to the test and has showed the big weaknesses of European healthcare systems. So, however, now the European countries have a big opportunity and have an opportunity to learn from the lessons of the pandemic and to work towards building a more sustainable and resilient health system for the future generation. So, as we all know, the European Union is really committed to this endeavor and is seeking now to promote more coordination and exchange between member states to address the cross-border health threats and to improve guidance and monitoring of healthcare system for the future. And among the urgent measures to be implemented to this end, for sure, a really important one is promoting a massive investment in vaccination and prevention. At Think Young, we are committed to this goal. In fact, for this reason, since a long time, so since 2019 already, we created the Young Coalition for Prevention and Vaccination, involving almost 40 young healthcare professionals from more than 20 European countries to raise awareness on the importance of prevention and vaccination. However, as we observe, despite the generally acknowledged importance of immunization around the world, vaccination, the expense in vaccination is not high enough still in most of member states in Europe. So our goal is today to raise awareness on the importance of vaccination and the importance to ensure that it's effective and is widespread around the European countries. So for this reason, it is important to discuss how to effectively exploit the funding opportunities that the European Union can offer us to boost national prevention and immunization programs. So to this end, we collected today these really important speakers. We are honored to have 4 very special guests today joining us to speak about this important topic. And we have Walter Ricciardi, President of the World Federation of Public Health Association. Welcome. Then we have Luca Rossi, head of the Unit Recovery and Resilience Task Force at the European Commission. Then we have Federico Guanais, deputy head of the Health Division at the OECD. And finally, Borislava Ananieva, European Patients Forum Youth Strategy and Capacity Building Assistant and YC4PV member. Welcome you all to our webinar. So, please, to everyone watching, send your question for our experts wherever you're watching us, and we will address this question at the end of our conversation. So let's start with an opening question. So for Federico, we know that from the 17 Sustainable Development Goals in the UN 2030 Agenda for Sustainable Development, they say ensure healthy lives and promoting well-being for all at all ages as one of the most important goals. And we know also that ensuring these healthy lives and well-being for all at all ages is also a really important goal as a precondition for the achievement for all the other goals, sustainable development, for all the sustainable development targets. So, Federico, in your opinion, how much was done before the pandemic in concrete terms for achieving this objective, and especially with regard to prevention and vaccination efforts?
Good morning to all. Good morning, Laura. It's a great pleasure to be here with you today. The short answer to your question is not enough. And I would like to start with an example of the influence of vaccination for population over 65 or more. This is a good marker of vaccination for adults, the vaccination for flu. So we know that across the OECD, just before the pandemic, the percentage of the people with 65 years old or more that were vaccinated stood at 45%. This is already a low number, and it's also a drop from what was observed 10 years before, when 49% of the people had been vaccinated. So in the last 10 years, it dropped from 49 to 45%. In the EU countries, in the European countries, this number is even lower. It's only 39% of the people over 65 report having been vaccinated for flu. And the main reason when we ask people, why didn't you get vaccinated, is that they don't see the need for it. So clearly, there is an important communication and outreach effort to be done to convince people of the importance of getting vaccinated. Now, I was talking about an old challenge, right? The influenza vaccination. So the emerging threats only compound and make things worse, right? Because for every new threat that arises, then there's the need for developing and testing vaccines to face this new threat, right? So it's like changing the engine of the airplane while the airplane is flying. And for that, I mean, we need to have continuous investment. And for example, if we had pursued the developments that happened when the first SARS came by in 2003, if we had continued to invest in the development of a vaccine for that, we would have been in a much better position as we are now. So whenever a new threat arises, we need to consider them and take them seriously to see whether we need to continue investing on that. But let me turn to another point, that vaccination is not the only picture of prevention. Another important role of having resilient health systems is healthy populations. So, and for that, we know that's very important to work on the risk factors. But we know that across the OECD, 1 out of 6 adults are daily smokers. And in Europe, this is even worse. 1 out of 5 adults are daily smokers. In Europe, this pattern is even observed in very young populations. 18% of the 15-year-old Europeans reported smoking. And more than 30% of 15-year-olds smoke in 3 EU countries. So this is a very important call to action. The same thing happens with obesity, right? Where across the OECD, more than half of adults are overweight or obese. So, and yet, given all of these risk factors, in a study that we did a few years ago, we found out that only 3% of health expenditure in OECD countries goes to prevention, which is a clearly missed opportunity. And all of that is important for the chronic diseases, for diabetes, for heart disease, for cancer. And it's even more important for COVID now, that we know that together with age, the most important risk factors for severe cases of COVID or for death of COVID was obesity and the presence of chronic diseases. So there's clearly an important agenda to be pursued in improving prevention.
Laura, I think you're muted.
Sorry. No, I was saying thank you, Federico, really much for raising this point, actually, because it's not just about vaccination, for sure. It's about prevention more generally to have a sustainable healthcare system. So thank you for this. So now, Walter, I would like to turn to you. So despite the fact that modern states should always be ready to face the threat of a pandemic, we heard a lot that it's something that can always happen, so we should always be ready for that. The world has found itself with inadequate political, social, and health instruments to combat the spread of the COVID-19 pandemic. So what do you think were the main structural weaknesses that European national healthcare systems showed in dealing with the pandemic?
I think the first structural weakness is in the legal framework. So essentially, the current treaties say that the healthcare services are in the hands of member states. So the responsibility for providing healthcare is in the hands of member states. And member states are very jealous of this prerogative. So in the past, when there has been an attempt to bring more responsibilities at European level, there has been a strong resistance by member states to do that. So we have to change the treaties. And now the pandemic is global, and you may understand that if we don't get out altogether from this problem, nobody will get out. So you can even think about a higher level of collaboration. But certainly at the European level, we have to change the treaties, which is a slow process with a lot of resistance from specific member states. So the first structural weakness is legal. The second is managerial. So essentially, the traditional way of managing the central organization tends to be very bureaucratic, while the pandemics tend to be very quick in actions and needs very quick and coordinated actions. Look at the vaccines. I mean, the 4 member states started the Inclusive Alliance. So considering the vaccines as a public good, Italy, France, Germany, and the Netherlands started to negotiate with at that time just a proof of concept, a vaccine in order to procure enough doses for vaccine to the citizens of these 4 countries. Then, luckily, responsibility was taken over by the Commission. It was the first time that the Commission took over this very important endeavor. But if you compare the kind of negotiation that was carried out at European level with, for instance, the kind of negotiation that was carried out with the US government, with the British government, or with Israel, you still tend to believe that this was very slower in comparison, because, of course, that was to respect some procedures. So legal and managerial challenges are the most important. And then the third one, which is cultural. As Federico said, the culture is very much in the hands of cure, not in the prevention. So the human nature is reactive, not proactive. We have to change that. If we change this with the lessons learned from the pandemic, I think we can see a better world.
Thank you very much. This is, I think, really interesting and also really true, unfortunately. So now I would like to go deeper about the lessons learned from the pandemic. And I want to turn to Luca. So Luca, the European Commission presented recently in June 2021 a communication on the early lessons learned from the COVID-19 pandemic and on the action to implement in order to avoid similar destructive consequences of future health threats. So in particular, if we look at the 8th point of the communication, it suggests to support continuous investments of member states in strengthening the resilience of their healthcare institutions and healthcare systems. So Luca, what are the concrete measures, in your opinion, envisioned to descend by the European institution, and how do they relate to the more general goal of building a stronger European health union? And also specifically, what role do prevention and immunization plans play in order to reach this objective?
Thank you, Laura. I can only echo what Walter has just said, that the pandemic has taught us some harsh lessons and has hit us unexpectedly and probably not fully prepared. And some of the lessons that the pandemic has taught us are those that Walter already highlighted, meaning that what happens in one member state depends largely on what's happening in other member states, and that only via unity and coordination between member states we can overcome this type of crisis. It's totally true what Walter said, that the responsibility for healthcare lies with the member states across, according to the treaties. That doesn't mean that nothing has happened meanwhile. So as also Walter has recognized, the European Commission has mobilized all means it was allowed to mobilize under the treaty. The European Health Union was at the core of the speech in 2020 of the State of the Union address by President van der Leyen. The European Health Union package was presented already in 2020 with some important elements. And just to come back to my role here, the Recovery and Resilience Facility has been put up in record speed in 2020, at the end of 2020, and this set to disburse in the next 5 years 672 million in grants and loans. Of course, it's not 672 billion that go to healthcare, but healthcare is an important part of the facility. It's one of the six. It's part of one of the six investment areas that are set out in the facility, what we call in recovery and resilience jargon, the pillars of the facility. Is actually in the fifth pillar. And the fifth pillar provides that the investment should go to strengthening the resilience of healthcare system. Given the amount of the investment of the money that is available, this is definitely a unique opportunity for member state, an opportunity that has never been before there before. It's the biggest investment plan, European investment plan ever. As you recall, Laura, the Commission has also adopted a few days ago, a couple of weeks ago, a communication on lessons learned from the COVID-19 crisis, and you have already highlighted the eighth lesson, the A team identified, which is the need for a continuous and increased investment in health systems to cope with pandemics in the future. I've already said that one element of this is the recovery and resilience facility. It's not the only element. The cohesion funds are also there for investment in health-related investment. One element that I would like to come back to also is what Walter already recalled, meaning the unprecedented effort by the Commission, and not only unprecedented because in terms of amount of money and in terms of contracted vaccines, we have contracted more than 4 billion and 400 million doses of vaccines, but also because it was the first time that the Commission found itself in a position to have to do that. And so I think all of this shows that there are some constraints, and the treaties may be one of those constraints, but a lot can be done together within those constraints without needing to necessarily think we need to change the treaties before we can do something.
Thank you very much, Luca. It's an interesting addition to what also Walter was saying before. And also now I want to ask Borislava. So Borislava, given your experience that you have at the European Patients Forum, so you have you can collect the point of view of patients as well, and also as a member of YC4PV, so member of our coalition. So what was, in your opinion, the impact that COVID-19 had on patients and patient organization, and what do they expect will change for healthcare infrastructure as a consequence of the pandemic? So, and also I think that I think it's really important. So how can patients' voices be meaningfully included and involved in the process of building back better functioning healthcare systems and prevention systems in the future?
Thank you so much, Laura. And thank you for the kind invitation as well. It's good to have the patient voice represented in an event like this. EPF actually did a survey throughout patient organizations and patients, asking them on the impact they had with the COVID pandemic. And we have some very interesting results that I would like to share with you today. The survey was distributed all over Europe and the European Union, and we have separated in two sections the results we received from patients and from patient organizations. So one of the main results that we received from patients is that 95% of the surveyed experienced challenges due to the COVID-19 pandemic, which I'm sure is no surprise to anybody. 72% of patients, however, surveyed were concerned about their personal safety when seeking healthcare. And here I think we can go a little bit deeper into considering what that cause might have been. 65% of patients surveyed all experienced increased stress and anxiety, and 52% of patients surveyed experienced moderate difficulties in obtaining the healthcare and services needed since the beginning of the pandemic. Here I would like to share another quote, which is 49% of patients surveyed all experienced treatment delay, where this is definitely something to be concerned about when you keep in mind that these are patients with chronic conditions, long-term chronic conditions, and need constant support. We also had information about a few places that I'm talking about hospital wards, for instance, for transplantation follow-up or organ transplantation follow-up and so on, which were completely closed and then turned into COVID follow-up centers. And it's honestly the last thing that patients would need in a time like this. Some other interesting key findings that I would like to share is from the patient organization side. 69% of surveyed patient organizations had to revise their 2020 work plan to survive during the COVID-19 pandemic. And in light of recent events, that is turning more and more harder to deal with. 50% of surveyed patient organizations were forced to change their organization's focus, which also can bring a lot on top of everything that is happening. And 63% of surveyed patient organizations were not consulted by their national governments at any stage for the handling of the pandemic. The people with chronic conditions were left aside from the pandemic management decision-making process. Of course, here we're not addressing the initial reaction towards the pandemic at all. We're talking about if there's going to be a change or some type of delay in the treatment of a patient with a chronic condition and their community, there should also be involved a patient representative on board to address the voice of the patients. And of course, it would be meaningless if we didn't provide some recommendations as well. And one of those recommendations is, of course, to involve patients with chronic conditions and their carers in considering measures, including actions to reduce patients' stress, feeling of isolation, and protect their personal safety and mental health. Here, when we say carers, we of course mean there's a lot of young adults or children who cannot speak up for themselves. And this is the place where the carers would come forward to represent their voice, which is of course very much needed as well. And another recommendation is to establish clear and easy to follow communication channels to be used by patients for reaching out to their healthcare professionals. We had a lot of people coming forward and saying that it's extremely hard to get in touch with, even for a simple control test or for a follow-up. And that should never be the case when you're a patient dealing with a chronic condition. Our last recommendation is to ensure clarity, timeliness, and accessibility of public health communications, which I believe we can all agree on at this point.
Thank you very much, Borislav, for this precious insight. I think it's really important to actually ask patients what they need and how they can be helped and what they miss during this pandemic. So thank you for this intervention. Also, now I would like to dig deeper in the healthcare sustainability and prevention. So, Walter, I would like to come back to you. So you had a long experience in the Italian healthcare system, and you are currently collaborating with the health working group in the context of the Italian G20. So you can provide us with a precious insight from both a national and an international level discussion on the future of healthcare systems. So in light of this, what is the role played by prevention and vaccination in view of the shared objective of fostering preparedness and resilience of national healthcare systems? And what are the key features that national and cross-national immunization plans should have in the future?
Yeah, as you said, the Italian presidency of the G20 is preparing the final declaration that will be discussed by the ministers of health in September. And I can tell you that after a large consultation with different bodies, we identified key actions by focusing on four priority areas. One is healthy and sustainable recovery, building One Health resilience, coordinated and collaborative response, and accessible disease control tools. And in these categories, was very much attention was very much paid to the coordinated and collaborative response to vaccination and to immunization. So the G20 has reaffirmed the recognition of the extensive COVID-19 immunization as a global public good. And the commitment for all collaborative efforts in this respect was very much emphasized. So the support to strengthen the resilience of supply chains, to increase and diversify global vaccine manufacturing capacity, particularly for low and middle income countries, including for the raw materials needed to produce vaccines, and to support the COVID-19 mRNA vaccine technology transfer hub launched by WHO. This is very important. And the possible extension of these actions to the world is of paramount importance, as I said, to get out. We want to produce, and this also in the framework of the COVAX Vaccine Manufacturing Task Force and the COVID-19 Technology Access Pool, to work together towards enhancing availability and access to disease control tools for many countries. We want to reinforce health systems by maintaining resilient routine vaccination programs to prevent large outbreaks of other serious vaccine preventable diseases, because we shouldn't forget that many immunization programs were slowed down or even blocked by the pandemic. So immunization is a measure that can help prevent high out-of-pocket health expenditures and minimize risk to public health from more transmissible and severe variants, and must be considered, again, as a global public good. Last but not least, we would like to acknowledge that inequitable access to disease control tools will extend the length of this pandemic. What is striking is to look at single member states, single politicians making the same mistakes over and over. And we are already now 2 years from the onset of the pandemic, and there are countries that are repeating the same mistakes. So again, exchanging this kind of experience in order to avoid politicians to make the same mistakes over and over, I think is of paramount importance. So yes, the actions that we are doing.
Thank you very much, Walter. And now I would like to go back to Federico for an important question of how the international organization can actually help in this process of fostering stronger healthcare systems in the future. So, as we said already, granting the largest possible dissemination of vaccines and unequal access to prevention independently from socioeconomic status and geographical location of individuals is very important, not just for the countries itself, but for the benefit of the entire world. So for the entire, in the interest, I would say, of the entire global population. So Federico, in this sense, what is the role of international organizations such as OECD in supporting national immunization effort in both developed and developing countries?
Thank you, Laura. As health economists, we usually invest a lot of effort and time in building the economic case for specific health interventions or a specific treatment, right? So we evaluate each treatment in terms of their cost effectiveness, so that can help countries to prioritize which investments they should make in terms when improving their health systems. But in the specific case of vaccinations, the evidence is so compelling that they are more than cost effective. They're actually cost saving, right? So it is the classical example of a public health intervention that actually saves money to the health systems and to societies alike. So it's like the textbook example. So in that sense, our analysis of the COVID and future vaccines has been much more dedicated to aspects of how to finance the acceleration of the development and how to reach an equitable distribution worldwide, right? Rather than to build the economic case of the importance of vaccines. So in our recent reports, we have highlighted the message that, just what Walter said, that governments should act collectively now to accelerate vaccination in all countries. So directing vaccines to where the need is the greatest is, of course, key for the humanitarian aspect, right? So which should be sufficient by itself, maximizing the number of lives saved. But there's also an instrumental reason for an equitable distribution of vaccines, right? This is the fastest way to end the pandemic and the fastest way to put the pandemic under control by slowing the transmission and reducing the likelihood of the emergence of the viral variants of concern, right? Which time and again brings this issue back again to our concern. So in that sense, in our latest reports and analysis, we have issued recommendations for high-income countries to allocate the supplies to areas of high needs in other countries as well, right? And to continue to invest in building production capacity and increasing supply. And also, of course, to providing further financial support to platforms dedicated to worldwide distribution, such as COVAX and the ones that Walter was mentioning. And of course, donating the surplus vaccines, among other topics. But this is important not only to manage the current pandemics, but also to make sure that countries are ready for the future ones. So we have also highlighted the message for policymakers on how the kinds of investments that are needed to prepare for the next pandemics, which seems unavoidable, right? So it's not a matter of whether another pandemic will occur. It will certainly occur, but what we can control is the impact of the next pandemics will have, and whether the impacts are going to be as large as the ones that we're observing today, right? So therefore, in addition to all of the work that needs to be done now, it's key to develop long-term strategies that include binding commitments to make vaccines available, so upfront commitments, even before the vaccines are developed, to make them available where they're needed the most, and then to ensure the future contracts for publicly funded development of products that address health emergencies, right? So that includes specific provisions, specific negotiations, specific agreements for the sharing of intellectual property and facilitating technology transfer. So rather than taking care of this when the emergency arises, we're in a much better position to do this before the next one comes around, to make sure that health systems are prepared everywhere.
Thank you very much. Very clear. Thank you. And now I'll come back to Borislava. So Borislava, in a recent study carried out by WHO, it emerged that immunocompromised patients taking specific medication are not fully protected by the usual two-shot vaccination. And so they still run the risk of getting infected. So these people, as other categories of patients, have specific needs that must be taken into account while rethinking the vaccination plans for now, but also for the future. So in your opinion, how is it possible to build a truly inclusive immunization systems, making sure that no one is left behind and making sure that we take care of the needs of everyone?
Thank you very much for this very important question. I would like to emphasize on what I said in previously today, and it's that involvement of patients and patient organizations at a very early stage in the development of systems and everything is very, very important. And in this case, patient representatives, patient organizations, like for instance, EPF, an umbrella organization with members who are also umbrella organizations, can really bring forward the patient perspective and represent the patient voice in a very meaningful way, which would then help the better involvement of patients in making key decisions and so on. One of the very interesting things that we saw through this research was that it only happens to some immunocompromised patients, not all. So it would be very interesting to see some further research, of course, to find out exactly what is the cause of this, how often is it happening, what we can do to actually prevent this. And there's already been a lot of research going on. Of course, it's ongoing right now. But something else that we can do, of course, is the very important, I'm sure that all of us would agree, herd immunity. So the more people that get vaccinated, the better. In some countries across Europe, when some patients cannot get vaccinated, they bring in their families so their families can get vaccinated and protect them that way. So once again, we come back to the herd immunity and how important it is for everybody to be vaccinated, as many people as possible, in order to protect the most vulnerable people in the population. So the points are pretty much the same. Again, in early stage involvement of patient organizations and patient representatives, and also herd immunity. Those would be the key things to take into account.
Thank you very much. And now we talked a lot about what are the lessons that we learned and what were the weaknesses at the beginning of the pandemic. So now let's go deeper on what we can do in concrete terms and what are the opportunities that Europe offers for better immunization plans to member states. So, Luca, the European Union recognizes the importance of fostering prevention and immunization, and as we said already, and since before the outbreak of COVID-19 pandemic and the development of the specific vaccine strategies for this emergency situation, European Union was making efforts in the direction of supporting national immunization plans. For instance, with the adoption by the Council in 2018 of a recommendation to strengthen the EU cooperation on vaccine-preventable diseases. So, Luca, how can the present EU funding opportunities, such as the EU for Health, for example, or the EU semester, be exploited in an efficient way in order to further boost national vaccination and prevention infrastructures?
Thank you, Laura. As you said, a number of EU financing programs were there before, and even more so are there now. You mentioned the European semester, and I've been discussing earlier about the Recovery and Resilience Facility. The two are closely interlinked, actually. The Recovery and Resilience Facility is embedded in the European semester exercise. And so if I start from what I've already mentioned, the RRF, as we call it for brevity, is a huge opportunity. The member states are using. We have seen a large number by now of member states plans, and those include dozens of billions of proposed investments in healthcare, and include also reforms without necessarily a price tag, which are as important as investments going forward. This is how the facility is linked to the semester, because with the help of the facility, we hope that member states will implement reforms that have been suggested in European semesters for many cycles now. Then there is what you already mentioned, the EU for Health program, which is the largest ever program in terms of amount put at the disposal of EU member states, health organizations, and NGOs, with 5.1 billion available to strengthen the resilience of healthcare systems and promote innovation in the health sector. We believe that this will make a significant contribution to the post-COVID-19 recovery by making EU population healthier, supporting the fight against cross-border threats, and boosting the EU preparedness and capacity to respond effectively to any future health crisis. Just to link this to what we were saying before, what Federico and Walter were saying before, at least 20% of the total budget of EU for Health, which is to say something in excess of 1 billion euros, should go towards prevention programs. Then there are other instruments that were there before, like the cohesion policy funds or Invest EU, and instruments that have been put up explicitly to respond to the COVID-19 crisis, like the coronavirus response investment initiatives, or the use of the REACT-EU, the massive use of the REACT-EU program to address the consequences of the immediate consequences of the COVID-19 crisis. As we have said a number of times already this morning, member states are in the driving seat in preparing their investment priorities and in setting up the projects, including for boosting national vaccination and prevention infrastructure and programs. However, they have, and the Union has put at their disposal a massive toolkit that they can use when doing so.
Okay, thank you. This is great to hear. There is a lot to do, but we have a lot of means to do it. So this is great to hear. And now back to Walter. Walter, do you think that national recovery and resilience plans should give more space and allocate more funds to the objective of strengthening healthcare and specifically immunization infrastructure? And as you have this insight, what can you tell us about the Italian case specifically?
No, I can tell you that in the case of Italy, enough attention is paid to immunization programs, was paid in the past and is paid for the future. Italy has a national health service, which means that we have a universal coverage where vaccination is considered as a minimum level of care. So it has to be provided for free to all citizens, independently of the socioeconomic and geographical status. Certainly we can improve. And in my opinion, the improvement is in a better coordination between the National Health Service and the general practitioners. As in the UK, the general practitioners in Italy are private professionals contracted with the National Health Service. And this means that sometimes the mechanisms of governance and coordinations are not exactly optimal. So this has to be improved. But in my opinion, enough attention. I don't know if other countries have to pay more attention, but in general, in the European Union, vaccination is a priority, both for children and for the whole life course. So I think we have to adapt to the future vaccination against COVID-19, which in my opinion will become endemic and will require a series of doses that we have, like for flu, to repeat every year or every 2 years. So we have to prepare to this new standard of procedures, which we already somehow prepared for flu in the past, and we have to prepare for COVID-19 for the future. So this is the kind of organizational effort that we have to focus on.
Thank you. So now moving from coordination at the national level to coordination at a more international level, Federico, in your opinion, how can European countries coordinate and support each other in building better vaccination infrastructures? And how important is to design to provide an effective monitoring system based on clear recommendation and measurable performance indicators?
Thank you, Laura. I'm going to focus on a specific aspect of the vaccination infrastructure. And you asked two questions. The first one in terms of the coordination among countries. So we have been working very closely with the support of the Commission, the European Commission, to provide support to a surge in demand of assistance that countries have come to us. Say, how can we improve our health data infrastructure systems? Right? How can we actually know what's happening? Because to monitor what happens, to plan, to prepare, to implement, and to monitoring an effective vaccination strategy, it's key to have a strong health data infrastructure. So several countries have approached us, for example, through the facility of the DG reform, support through structural reform. So how can we improve our health system performance assessment framework? how can we improve our health data infrastructure? And we're taking up advantage of this to promote this cross collaboration across countries and to bring the lessons from one country to the other and say, okay, what are the best approaches to improve and to strengthen and to modernize our health data infrastructure? So and let me explain why it's key to have a strong health data infrastructure in the context of the COVID. And that's even before the vaccination aspect, right? So if you remember well, in the beginning of the pandemic, as countries were starting to organize their surge capacity to treat more patients, how many countries could generate day-to-day statistics about what were the number of ICU beds available, what are the number of ICU beds occupied, right? So very few could do so. How many countries could actually generate statistics about, okay, where are my supplies of face masks to the health professionals that need to treat the patients? Very few countries could do so. So it highlighted some important structural weaknesses of the health data systems to organize and plan the response to emergencies such as this one. So as the pandemic progressed, then there were other needs emerged, right? So for example, how can the primary care physicians know which of their patients had been hospitalized for COVID, right? So I have my patients at risks. Were they hospitalized? Were they discharged? What happened to them in the hospital? What kind of follow-up treatment do I need to do? And for that, it's key to have a health data systems that follows the patient. Like Borislava was saying, the importance of put the people at the center of the health systems. And then, as the vaccines became available, the strong health data infrastructure became key for other aspects. For example, right, you can prioritize age as a risk factor for severe cases of COVID, but so is the presence of chronic diseases. So unless you have a strong health data system, you don't know who those are. Who are the people who are immunocompromised, for example, like Borislav was saying? Who are the families that can be notified and put them on a priority list for receive the vaccination? So that's important because who are the millennials, for example, that have a chronic disease and should be placed on priority list of vaccination? So for all of that, it's key to have this strong health data infrastructure, but it does not end there. So we need to actually, even after the vaccination, follow up. Well, did my vulnerable patients actually get the 2 shots? Did they? What happened to them afterwards? And one of the reasons why Israel was so effective, for example, in negotiating advance contracts for vaccines was not only their financial package, but also their ability to say, look, we have an integrated healthcare health data system that's able to follow in real time what happens to patient afterwards. So one of the first high quality studies that we found received from the effectiveness of the vaccines in a real world data context were from Israel, right? Because they were able to leverage that. And yet we know that across the OECD, very few countries are able to do that, right? So very few countries have the key health data sets that are integrated, that follow the people, and that they're able to report this data in real time. So I think that having a strong health data infrastructure is key to be able to organize, monitor, and continuously improve the effective immunization response.
Yeah, sure. I think collecting good data and using them in a good way is key in many sectors, especially in the health sector. I completely agree. And now I would like to ask one last question to Luca. And this question is pretty important for us as we are Think Young. So we always care and we try to understand what is the best way to involve young people, to pay attention to the needs of young people as well. So Luca, as we said many times during the webinar, is a task of the governments and institutions to put efforts and funds into strengthening national immunization systems. However, effective prevention plans cannot be built without the cooperation and coordination of well-informed patients. So specifically, when it comes to prevention constitutes a lifelong journey. Citizens should be educated from early ages to that. So how does the European Union engage or eventually plan to engage with young people in order to make them aware of the crucial importance of vaccination and in order to empower them to be vaccine advocates for other young people, as it's so important that also patients work towards this end?
Maybe Laura, let me start from where we are at today. President von der Leyen set quite early on in the process an ambitious target, which was 70% of the adult population in the EU being vaccinated by this summer. And yesterday she announced that 57% of EU adults have been vaccinated with 2 shots, and 70% have been vaccinated with the first shot of an immunization program that requires 2 shots. So we are well on track to reach that target and to go beyond that target by the end of summer. So that's a first good news. Another good news is that adolescents now can be included in the vaccination program, because the Commission has authorized already both the biotech Pfizer and the Moderna vaccines for adolescents, based on the recommendations from the agency, from the EMA. As also Walter said earlier, we need now to be prepared for the next stages of the pandemic, for 2022 and beyond, for the case that he said he believes to be probable of the COVID-19 becoming endemic. We know that we need to be vigilant about the sustainability of the vaccine-induced immunity and the impact of the variants. So raising awareness is not only crucial now and up until now to get where we are at and to reach the final goals of herd immunity, but also going forward. As you well know, the European Commission convened the Coalition for Vaccination, which brings together a number of European associations of healthcare professionals and other stakeholders. EU, meaning Think Young, is an associated member of the coalition, and of course the Commission can only welcome the objective of the coalition to support delivering accurate information to the public around vaccines and vaccinations, and exchanging best practices on that. We encourage you, your members, to be proactive in encouraging COVID-19 vaccination. We need to fight any complacency among young people, and peer education, and if I can put it so, a bit of peer pressure in this is key. We also fully support the objective of the coalition through the so-called EU Immunion project to promote vaccination uptake across the EU. And to support the strengthening of collaboration between healthcare professionals, public healthcare authorities, media, and local communities.
Thank you very much. Yeah, as Think Young, we really, of course, we are really engaged in this objective. We really believe in the importance of vaccination, and we will happy to keep working together with the European Union as well towards this objective to encourage vaccination among young people and among the general population. So now we have some time for a couple of questions from our lovely audience. Let's see. So Marta, so she asks, the main objective of the Recovery and Resilience Facility and of the Next Generation EU, more generally, is to support the green and digital transition of the member states. How does transition relate to the health and healthcare systems? And I would ask, I'm sorry to come back to you, to bother you, Luca. I don't know if also other speakers would like to answer the question as well, but I would probably address it to Luca as his expertise.
I think it's fair. as I said earlier, the facility is organized around 6 policy areas, what I call the pillars. Green and digital are 2 of those pillars. It's true that are the 2 pillars, the only 2 pillars, which have a quantitative objective, because the plans need to have a certain share of green investment, 37%, and digital investment, 20% in them. But as I said, healthcare is one of the 6 pillars, is included in the 5th pillar, and is therefore one of the stated objectives of the facilities. But these 6 pillars are not boxes which do not communicate with each other. Of course, there are synergies between pillars, and there are projects that address more than one pillar. We see projects in the plans addressing, for example, the green and the health pillar by renovating and making more energy efficient health infrastructure. But we see even more and even more importantly, both in terms of amounts invested and also the possible impact on the health sector, a huge synergy between digitalization and so the digital pillar and the healthcare sector. The digitalization of the healthcare system in many member states is one of the top priorities of the plans, and is one that we really wholeheartedly support. We cannot see in the future any other instance in which data will be shared with fax machines.
Thank you very much. Thank you. Let's see if the audience is okay. So this question is for Borislava from Romania, because there is a first part of the question I see as well. So the question is that about the findings from your survey. So if you are planning to elevate these findings to any pan-European institution that could actually address those problems that you underline.
Thank you very much for the question. At this point, the report, both the report and the infographic of the survey are public, and they're on the EPF website. You can easily find them. As for planning on elevating them to any other pan-European institutions, I'm not sure I can answer that at the moment, but I'm sure that it's on the agenda to more widely spread the message and recommendations that we have in the report.
Laura, can I just jump in just to say that, Borislava, this report is a great one. We have already picked it up, and we have already included in a report we're going to publish in the fall, in autumn, about people-centered health systems. There's a specific chapter on the importance of involving people in the response to COVID, and this data that you presented were great, right? So, for example, in highlighting the absence of patient organizations' involvement in the response to COVID, right, in which the need for speed actually trumped all of the need for involving people, and which may lead to resistance later on, because never have we needed so much the involvement of the people in compliance with social distancing, in complying with public health measures, in compliance with vaccines, right, overcoming vaccine hesitancy. So clear communication and involvement has never been any more important than it is now. So just to highlight that we have already picked it up, and we'd like to congratulate you for the report.
Thank you very much. That's great to hear. Yes, definitely, it's something very key that we need to focus on more, not only for vaccinations, but especially for vaccinations now.
That's great. And also, like, fruitful collaboration are also like starting here from our panel speakers. That's great. And so unfortunately, we don't have any more time for any further question from the audience, but I would like to give you each 30 seconds just to collect your final thoughts. So give a final message. And I would like to start with Walter. So just a final. consideration?
Yeah, I think that the future is international collaboration from all points of view. So the future is global and can be managed only at the global level. Of course, that doesn't mean that we have to forget our local conditions, cultural, social, economic, but the roots of our future is in the international collaboration.
Thank you. Now to Federico.
Most importantly, I'd like to thank you for the invitation, for the privilege of speaking to you today. And as a final message, I just want to repeat that more than ever, we have abundant evidence that investing in healthcare and investing in preventive care is key to sustainable development, right? To the sustainability of progress. So I think that now with the pandemic, we have a policy window for investing in health, which is open. Like Luca highlighted, all of the funds that are available for investing in health. But this policy window will not last forever, right? So we have a collective responsibility to pursue an agenda of making the right investments, making the solid investments to make sure that when the next health shock comes, health systems everywhere will be better prepared. So I just like to close by saying that I think that the talent, the digital skills, the motivation to change the world, and the fresh thinking of the millennials and the Generation Zers are highly needed to have revolutionized health systems. So we're counting a lot on your collaboration to make this transformational effort. Thank you very much.
Thank you. Now, Borislava.
First of all, thank you very much for the opportunity. This has been great and I'm sure very helpful for the whole audience. My final message would be in the site of involving patients in decision-making processes, we are here and we are ready to be involved. So please do involve us in the decision-making processes, and I'm sure that this would be very helpful for the majority of our most vulnerable population. And get vaccinated is the other final message.
Thank you. Really, always important to remind. And finally, Luca, to you.
Yeah, being the last one, I have the advantage of being able just to echo what has been said by the previous speakers. The first thing that I want to echo is, of course, get vaccinated. This is the first main message, but also what Federico was saying is of crucial importance for us. We have been discussing for around an hour of the amount of money that is on the table and the unique opportunity that that amount of money provides to all of us. But that amount of money is nothing without the correct implementation of the investments that can be brought about by it. And for this, we are now, of course, as the European Commission, focusing on the implementation, on the correct implementation of the plans that we have been approving. But we need, if I may say so, all hands on deck. We need all of you. We need all associations. We need patient associations to on the ground check that the investments are carried out as planned and deliver the desired outcome.
Thank you very much once again. Thank you very much to all our speakers and our audience. I hope you enjoyed the conversation as much as I did, and we did, I would say. It was really interesting and really useful, I say, and I hope to collaborate in the future again. And thank you all. And yeah, get vaccinated. Thank you very much.
Thank you.
Bye.